Hello everyone, welcome to the 6th episode of Facebook Live session. Let's talk health. Today here I am introducing Dr. Palepu B. Gopal, who is the senior consultant in critical care medicine in Hyderabad. Today's session is about sepsis and its management. Good evening sir, welcome to the session.
Thank you.
Can you brief us about your experiences in critical management?
I will. Thank you very much. I am Dr. Palepu B. Gopal. I head the critical care services at Citizen Specialty Hospital, Nallagandla, Hyderabad. I have a team of 12 intensive care doctors working around the clock for the welfare of the patient. 6 of them are qualified critical care consultants, super specialty qualifications, and 6 of them are trainee critical care specialists who also man the unit 24/7. We strive to give excellent and point of care service with very low turnaround time for our critically sick patients.
Thank you sir. So can you tell us about sepsis and what are the causes for it?
That's a very important question, and often many educated people also get confused between sepsis and infection. Sepsis is the consequence of infection. A patient can have infection in any part of the body, especially open organs like lung, urinary bladder, intestines, etc. When infection attacks the body reacts to it, and when the body reacts to it, it releases several chemical molecules. The fight between chemical molecules and the infection causes sepsis. Sepsis is effect of infection in one area of the body on the other area of the body. For example, patient may have infection in lungs, but his kidneys start malfunctioning, his BP starts falling, his liver starts malfunctioning, he becomes drowsy. These are the symptoms of sepsis and these are the consequences of infection. In other words, the deleterious consequences of infection of one organ on the other organs is called sepsis.
So can you brief us about the signs and symptoms of the sepsis?
Definitely, madam. The signs and symptoms of sepsis usually occur in patient who unfortunately has infection of one organ, for example, pneumonia or urinary tract infection. It usually manifests as lethargy, drowsiness, drop in blood pressure, drop in appetite, drop in urine output, and sometimes patient being in complete shock and being unconscious. When one of these symptoms occur, they have to immediately consult a senior doctor in one of the major hospitals like citizen hospitals to check whether the primary source of infection is controlled or not and whether it is leading to sepsis, because this involves a multi-specialty management in an intensive care unit.
Okay. So sir, what is the golden period of the sepsis?
Generally, as early as possible. It has been proved in multiple studies that if there is infection and if you can give appropriate antibiotics in the first 1 hour, which can be called golden hour, the mortality and morbidity comes down drastically, and the incidence of sepsis because of infection also comes down from a severe form to milder form. So people have to, the common public and people have to understand this fact that early reporting to hospital with either signs of sepsis and infection is vital for their well-being and survival.
Okay, thank you sir. Can you tell us how these sepsis are diagnosed?
The sepsis is usually diagnosed with presence of infection. First of all, we strive to see which organ in the body is infected. When a patient comes to us with fever, high white blood cell count, and one of the symptoms of sepsis that I have suggested in your previous discussion, the investigations have to immediately start with simple investigations like chest x-ray or CT scan if required and various kinds of blood tests. The indicators towards sepsis and infection are raised white cell count, raised molecule called CRP, and in some complicated cases, raised procalcitonin. When all of these things happen together, we diagnose sepsis. Sepsis can also be diagnosed by a scoring system called SOFA scoring system. If SOFA scoring system is more than 2 or another scoring system called quick SOFA is 3, then we diagnose that the patient has sepsis and start treatment as soon as possible.
By this thing, we just want to know who is at the risk of developing this sepsis.
That's a very important question. Elderly people, very young children, patients who have severe uncontrolled diabetes, patients who have malignancies or cancer therapy, patients who are under immunosuppression for organ transplantation, patients who are under severe stress or malnutrition. These are the kind of patients who are amenable to infection and ensuing sepsis.
Can they prevent the sepsis?
Sepsis can be prevented to large extents by early intervention. When an infection is diagnosed and patients has received appropriate antibiotic followed by, if necessary, IV fluids to keep him hydrated and other supporting agents, sepsis can be prevented. But it may not be 100% foolproof. Again, like you asked in your last discussion question, early reporting and early management can definitely prevent sepsis.
Okay, sir. Thank you. And I just want to know, what is the multi-organ failure?
That's the crux of the whole plethora of diseases called sepsis and multi-organ dysfunction, multi-organ failure. Basically, patients react to infection. When initially patient's body reacts to infection, systemic inflammatory response syndrome, what we call as SIRS, happens, and this response syndrome sometimes overshoots. Initially, he may show fever, high white blood count soil, high CRP, etc. But when the sepsis is overshooting the immunological reaction, patient may enter a second stage called multi-organ dysfunction syndrome. One of the organs can start dysfunctioning, like his urine output may drop, his BP may drop, his heart rate may increase, he may feel drowsy. When one of these organs completely stop working, for example, let us say he completely stops passing urine or blood pressure goes down to very critically low levels, then he enters a third stage called multi-organ failure syndrome. The whole purpose of early recognition of infection, control of sepsis, and admitting patients in critical care unit to control either multi-organ dysfunction syndrome or multi-organ failure syndrome is the primary work that we do in critical care units. It's also important to recognize early signs of failure of organs and try to go to an expert unit to prevent further deterioration.
Okay, so how this multi-organ failure can be diagnosed and what are the causes?
Yeah, we have discussed extensively about multi-organ failure diagnosis. We basically monitor these patients very closely regarding their vitals, like their heart rate, their blood pressure, their urine output, their temperature, and various lab tests. When one of these tests is abnormally or critically different from the basic values, then we start suspecting multi-organ dysfunction syndrome. When one of these organs completely fails, for example, as I told in the previous discussion, if they stop passing urine or the blood pressure starts requiring drugs called inotropes or vasopressors to keep the blood pressure up, then we diagnose multi-organ failure syndrome and start treating it. You may ask, what is the treatment? For example, if patient's respiratory system is failing, he has pneumonia, or as a part of the sepsis syndrome called ARDS, adult respiratory distress syndrome, then we start using ventilators on this patient. There are various kinds of ventilators. It needs an expert to handle a ventilator and it can be done only in ICU. There are drugs to support falling in blood pressure. There are drugs to increase the urine output if the urine output has decreased, failing which we may even need to dialyze the patient. But in very advanced units, level 1 units like the one Citizen Hospital has, we have further devices which are life support devices. If the patient is already on a ventilator, already on a drugs to support the blood pressure and it is not working, we have another system called mechanical support systems. These mechanical support systems have become famous of late, especially after the COVID pandemic. It is called ECMO, extracorporeal membrane oxygenator, which overtakes the function of both heart and lung and waits till the patient recovers and the drugs that we administered work, and then the ECMO can be weaned off and patient can become better.
So you say that multi-organ failure can also be managed?
It can be managed, definitely in advanced.
Multi-organ.
The multi-organ failure management is symptomatically and functionally supporting various organs which have failed. For example, lungs have failed. We are basically talking there about starting from simple oxygen to keeping the patient on mechanical ventilation. If urine has failed, patient is not producing urine initially, we say try some drugs, and if that doesn't work, we go for a dialysis. If his heart has failed, we can use ECMO, which our hospital has tried many times in patients successfully, and a combination of all these missions keep the patient alive, waiting for recovery of the patient and waiting for the action of the various medications that were put on the patient.
So the last question for you, sir. What is the prognosis of this multi-organ failure?
It depends on number of the organs failed. We have also various coding systems. For example, there is a system called Apache system, which can be Apache 2 system, which you can implement when the patient is admitted, and we can generally assess how much are the chances of this patient surviving. Then as the patient is admitted daily, we can assess something called SOFA score, which tells us the progress of the patient and the possibility of patient coming out of this disease successfully. And then of course, depending upon the basic characteristic of the patient, his age, his diabetic status, his immunology status, and the response to various drugs which can also give us the prognosis of the patient. But if the number of organs which have failed are multiple and timely support is not done, the prognosis can be quite severe. Having said that, early reporting to a good hospital and a good ICU, early institution of antibiotics, and early intervention for a failing organ greatly improves the prognosis and survival chances.
Okay. Thank you, sir. Thank you so much for your good explanation about multi-organ failure.
Thank you very much for this opportunity.
Thank you for tuning into today's Facebook live session. Let's talk health with Dr. Palepu B. Gopal. Next week, we meet with some other doctor with new topic. If any comments, please post it in the comment box. Thank you all.